Okay, so thank you for coming to this event. Um, it is part of a whole series of health talks, but today it's on lifestyle intervention to restore inflammation of the intestines. Okay. So you've seen the start, so we'll go through these slides. First of all, our target is to balance the microbiota in the intestines and to have, of course, the right diversity and the abundances to provide, of course, the health promoting metabolites, which are substances that are important as anti-inflammatories, antioxidants, and neurotransmitters, as we will see during this event today. When there is a disbalance of these microbiota, we call that dysbiosis. And by understanding what is the dysbiosis, we actually do understand the cause of chronic intestinal inflammation. Now, to restore this particular dysbiosis, we need lifestyle interventions and we need to balance both microbiota, but also the lipid profile. Because another aspect that we look at is the lipid profile, which is extremely important for anti-inflammatory action in our intestines. Throughout this event, because it's, of course, it's a Q&A, question and answer event, you can unmute and ask questions, we can discuss, and you can also send your questions via the chat box so that we'll answer your queries. It has been quite a nice couple of months where we did our best to innovate specific programs. And today I would like to say that we managed to launch a gut restore program, which is a test-based approach to identify the cause of chronic intestinal inflammation. And this is not only providing the result, but we also follow with lifestyle interventions and personalized supplementation to resolve the inflammation. So the concepts of this particular program is to, as I said, understand what is the imbalance of the microbiota and lipid profile and try to understand the status of pro or anti-inflammatory responses. Once we find the cause, we can restore with personalized interventions. And here we utilize lifestyle intervention and a holistic lifestyle intervention approach. To understand more, I will refer you always to our YouTube channel where we have a series of gut health health talks and of course other information that is required. So, so what are these lifestyle interventions that we're talking about to regain intestinal function? So if you look at the pie chart first, we know that we need to resolve the inflammation, we need to measure microbiota and lipid balance, and then integrate these particular lifestyles, which include nutrition, stress management, physical activity, substance use, environmental exposure, sleep, and sexual health and fertility. To find the cause, the only way is to actually do tests. And here we actually have two specific tests, the microbiota test, which is provided by a fecal sampler. So once one would provide us with a fecal sample, and also a lipid profile test, which is a finger prick, and then we take 6 blood drops into a dried blood sample, and we look at the full spectrum lipid profile of the individual. There are various lifestyle interventions and includes various disciplines. Okay, so we have now, the team is expanding, and we have a team of nutritionists, which is headed by the exercise and nutrition scientist. We do also have pharmacologists, which you can see also on your right. And we also have psychologists, natural remedies experts, and gut health experts. And as part of our team, we have nutritionists headed by Claudine Grex-Peteri, then the substance used, which are medicines and understanding how they affect the gut flora. We have Yekaterina. No, that surname is quite difficult, but I try it, Parovinchaka. Okay. But with us as well, attending this talk, I also see the gut health expert, Pankaj Pandya. Thank you for coming. And also we have experts in natural remedies. Thank you for coming, Alexander. Okay. And others that form the full team. Okay. In terms of such programs, we also include coaching. Okay, we do tests, but we explain what the results are and how we are setting the lifestyle intervention, because the importance is that we need to ensure self-continuity for a healthy lifestyle. Okay? And as I said, interventions include the list that we mentioned before. So sometimes I will ask if there are any questions, and please do so if there is any question related to Spark. Yes, please. I can see a raised hand. You can unmute and please do ask your question or write it to the chat.
I have a question about fibromyalgia. Is it related to gut health?
Come again? Can you say it again?
I have a person who was asking, is fibromyalgia related to gut health?
Yes. So fibromyalgia is a condition in which it is pain in joints and immune tolerance issue. And the answer, very simple answer, is yes. There is dysbiosis, would result also in a problem with providing secondary bile acids. We will mention some of these metabolites as we go along today. And because of the absence or increased amount of specific bile acids, and also due to the immune repertoire, so the immune cells that are learning from the intestinal layers, okay, yes, there is a direct connection between dysbiosis and fibromyalgia.
Thank you, Godfrey.
You're welcome. Good, so we can maybe go ahead. Always keep observing these nice steps, okay? So, of course, to go and have a healthy lifestyle, we do have some important aspects that we need to climb together, okay? So always observe the stairs that we are looking at and the figures, okay? Extremely important. So what are the pillars of lifestyle medicine? there are various, but these are the main ones. Nutrition is absolutely important because it will provide the right nutrients, but also provides the means of having a balanced microbiota with the right abundance and diversity. Physical activity is another pillar. Sleep hygiene is also important. Please do make sure to take your good rest. Stress management is absolutely important. Stress would increase specific hormones, and these hormones would also regulate the gut. Just to give you a little bit of understanding of this, if somebody is stressed and therefore there is the flight and fight mode on, okay, then the energy of the body is required for the muscles to do something. Okay? Now, there is a specific connection with the gut in which if you require, you keep in mind that digestion is continuous, it's all the time. So you use a lot of energy to digest, which is a continuous activity. So when there is stress and anxiety, then of course one would need energy somewhere else, and there is a direct connection to stop the gut from functioning. So it's extremely important to keep this in mind. This is correlated and associated via cortisol being one of the hormones that are related to it. So I can see that there is another question. Yes, please.
When I see these lifestyle examples, as a parent of two children, I see that they are all in one. Because when you have children, there is a problem with nutrition, there is a problem with time for physical activity. Maybe you cannot sleep well because of the baby, and more work, so more stress. And also sexual health, maybe, when there is children, it's impaired as well. Also social connection. And so usually if you go with friends, if they don't have children, it's like a bit a problem.
Okay.
So it's all connected also from experience of being a parent, that parenthood is also one of the point of reference when people become sick sometimes. Also the hormone imbalance that happens during the maternity. So I think that is a very, very sensitive time for the people when they become parents.
Yes, yes, absolutely. That we go through events in our lifetime that would be very difficult to control the aspects of lifestyle medicine, of course. It could not only parenthood, it could also be exam period, it could be various other events which will affect these pillars. Okay. Of course, we can do what is in our control. Okay, but having the knowledge that one would need to take care of these specific activities as much as possible and as much control one would have, it's important to take care of them. Of course, when I'm discussing these particular activities, I'm discussing it in the context of somebody would have to do an intervention because there is a dysbiotic event. Okay, so in terms of dysbiosis, we would need to tackle all these as much as possible and as much as practically. Of course, I understand that various events would have problems to control these pillars, of course. Good. Thank you. Thank you for indicating that. I definitely confirm that being a parent, it's very difficult to control most of these. So I confirm that. Good. So in addition to stress management, we do have substance use. And here we're talking about both substances in terms of smoking, drugs, etc., but also medicines. We're looking at specific amount of medicines that are being utilized as we look at a wholesome, holistic intervention to a specific personalized client. Okay, so we have also sexual health and fertility, which is extremely important in terms of providing the right balances. But as you actually said, if in terms of pregnancy and whatever, of course, and menopause and other kind of events, these will perturb the hormonal levels. But there are options to that as well. So one would look at the personalized interventions. The importance of social connection is extremely important. So it's good to have friends and good friends, which you can actually discuss specific issues, and also gathering in terms of social activities. And there is environmental exposure. Of course, we are exposed to where we live, but there are some things that we can control, and we will discuss that in a second. First of all, I would like to thank you for taking part in the poll that I organized in the group called Gut Microbiota and Disease. I would also invite you to actually be part of the group, which is a Facebook group. And the main question here was like restoring gut microbiota is crucial. Yeah, we know that. And discovered by one of the following interventions. And here I basically listed the different interventions. And you picked your idea. All right. And let us see the answer in a second. So if we look at the lifestyle interventions, I think this is also a video. Yeah. Okay. So there are these pillars that we mentioned. So there is nutritional interventions, which is the first figure. It does affect gut microbiota. Stress management, it does affect microbiota. Sleeping condition is also affecting microbiota. Also exercise. Also substance use affects a lot microbiota. But actually, microbiota themselves, and if I will explain this in terms of, I always say that the gastrointestinal tube runs from the mouth to the anus, and therefore it is an external tube inside us. So within the lumen that you can see here in this figure, in which the microbiota is actually present, it's actually our environment. It is one of the most direct environments in terms of environmental exposure that we have inside us, and is extremely important in providing us with the right nutritional metabolism, so the right metabolism of different nutrients, but also production of health promoting metabolites. So although the others are affecting the microbiota diversity and abundances, actually the present microbiota profile of an individual is a direct environmental exposure to the production of the right health promoting substance. Okay, so the answer would be it is the experimental exposure, but it is affected by all the other pillars. And thank you for your participation in the poll. Good. So if you have any questions, I will also stop for a minute. Yes, when you see the Q&A, ask away, you just unmute and ask. Go on.
So, Godfrey, from your experience, which one would we think that it's the first pillar that causes this chain reaction? Those lifestyle that we need to figure, which one from your personal experience is the one that is like the primary cause?
Okay, in terms of intestinal inflammation, if we think about and focus on intestinal inflammation, the abundance and diversity of microbiota is the main culprit. As I said, it's affected by all of these pillars, okay? And the main direct effect is, of course, what we eat. Okay, so that's the first main direct effect. All the others are, and also medication. So morphine medication is a very direct effect on the microbiota levels in terms of abundance. So if you define environmental exposure as the microbiota level, then that is the main one in terms of intestinal inflammation. Okay, but all of them come together and provide us with the right balance of the microbiome.
So nutrition is the first, right?
I mean, first and second, so nutrition is something that we eat every day and we have to take care of it every day. It's something that we can control easier than the others, I would say, because it's very difficult to control stress. It needs some time and some interventions. It's very difficult to control the time of sleep if there is a problem in sleeping habits. No, unfortunately, sometimes we do not have control of. We have to have medications, and these will affect the microbiota. So the major, let's say, the major effect that we have control on all the time is actually nutrition.
Mm-hmm. From my experience speaking with people, especially that suffers with IBS, some people said that breastfeeding, the primary nutrition of us, is a very, very important pillar that it could change our lives completely, from being healthy to being sick for life. So do you think that breastfeeding, from your experience, that really is the very, very first nutrition that affects our gut health?
Good. Okay, so it's a very interesting question, very important question. There's maybe something before that. So again, I always focus on the intestinal inflammation only. Okay, so there are various aspects about immunity, which is important. But if I had to focus on intestinal inflammation, and because the major sort of effect is the presence of these microbiota, there are two major effects on what colonizes the gut of a newborn. Two. Okay, what is colonizing? Sorry, I might use sometimes difficult words. So colonization is okay. So until there is the fetus, okay, is not born, and then eventually there's a newborn. At that point, we believe that the gut is not colonized by bacteria. And the first exposure is the type of birth. It could be vaginal or a C-section. And between these two types of newborns, we see a completely different colonization of bacteria of the gut. One of them is more derived from the vaginal bacteria, and the other one is more derived from skin bacteria. Okay, so that's the one of the biggest major differences between newborns. The breastfeeding or formula fed, okay, there is a lot then that colonization, which already depends on the birth process, okay, continues. And there's a huge difference if you take sort of the newborns that are from vaginal delivery and forget the others. There is a huge difference in the colonization of the gut between breastfeeding and also formula fed. So yes, and these are two specific events and activities that have a major impact on the levels, abundances, and actual diversity of these bacteria, which are the main issue related to intestinal inflammation. But there are other aspects. There are aspects of immunity, etc., etc. But I need to focus here, of course, on one specific aspect. So the answer is yes. So but I have to explain when I say yes, of course. Oh, yes, sorry. I have some notes here I missed in the chat. Yes, that's true. Thank you, Dr. Pandya. And please do intervene with your also experience. It's really so. Let me introduce Dr. Pandya. Dr. Pandya is a lifestyle medicine clinician with a lot of experience as well in lifestyle interventions. So please, Dr. Pandya, you can unmute and give your intervention anytime.
Thank you, Godfrey. Thank you very much. I'm listening. I'll comment whenever I feel that I need to add something more than what you're saying anyway. Thank you.
Yeah, I asked you to intervene because you sent a message.
Yes.
Saying, detailing a practice, please go ahead.
Yeah, that's an interesting topic at this moment, you know, vaginal delivery and C-sections. The C-section, the rate of C-section is increasing, unfortunately, you know. So this is what they are doing, trying to improve the gut microbe of the newborn. They are swabbing the vaginal area and swabbing the face of the newborn child. That's one way of trying to get the good microbes into the system of the newborn. And the second one, of course, you already mentioned, is the breast milk. There's a lot of microbes, the positive microbes in the colostrum of the breast milk. So that's a good start for the baby, vaginal delivery with breast milk. So that's what I wanted to add, actually.
May I ask a question to Dr. Pokain?
Yeah.
Why this section is increasing?
It's mainly because of the, well, C-section is important when it is really indicated, when the health of the child or the mother is in a danger situation. So you go for C-section. But I think what's happening basically is that mothers are taking an easy way out. I mean, easy in the sense that, you know, childbirth itself is not an easy process. So some of them are opting for C-section mainly for, I'm sorry to say, for more comfort reasons, basically. Really.
Wow, thank you. I agree.
Okay, so thank you for that intervention, but really feel free anytime to add on to
Thank you.
with your experience, Dr. Pandya.
Thank you.
Okay. Good. Okay, so let's move to another step. Okay. So why are these so important? These microbiota. Here you have a representation of, like, you have the lumen, which is the hollow tube of the gastrointestinal tube, the intestines, in which in this hollow tube you have this these microbiota, these bacteria that are important to produce health-promoting metabolites. And this nice colorful pie chart show the different metabolites that are being produced by these microbiota based on what the gut is receiving. One of the things that the gut receives is actually bile acids, which are emulsifiers of fat, which are produced by the liver. And these primary bile acids are also converted by specific bacteria through a specific enzyme to produce secondary bile acids. So these are health promoting. Sometimes it's extremely important to also excrete the bile acids rather than recirculating them. Something which is extremely important in the regulation of LDL levels in the blood. Okay? So there are various bacteria with different enzymes that actually does this very important conversion. Now, keep in mind that if you think about the human body is made up of, let's say, 30 trillion cells. Of course, these 30 trillion cells have the same genome, okay? They have the same DNA. So we are limited, let's say that, with the different types of enzymes that are required for the full metabolism that we require and to digest, absorb, and change hormones into active or deactive forms. So, but if you think about, therefore, so we are made up of 30 trillion cells which have the same DNA. Now, if you think about in the gut, in the large intestines, there are over 100 trillion bacteria from thousands of different species, and all of them have different DNA material that produce different enzymes. So basically, by having them in our gut, in our large intestine, we increase the repertoire of enzymes, which are active proteins, to convert substances into healthy metabolites. And therefore, that's why they are extremely important and we call them beneficial, because they have a positive impact in producing health-promoting metabolites. One of them is the bile acid conversion. The other one, the conversion of carbohydrates, for instance, into short-chain fatty acids, a very important conversion which is health-promoting. And that's called fermentation. So they ferment very complex carbohydrates because they have specific enzymes that we do not produce. And they convert them into these very important substances. Short-chain fatty acids are important as an energy source for the cells in the gut lining, but also extremely important as anti-inflammatory metabolites or healthy substances. And there are various other conversions that are important that are done specifically by these active proteins, by these enzymes that are produced by the microbiota. And here is a representation of this. Now, one of them, because we are going to focus on inflammatory interventions and the inflammation of intestines is actually they produce substances that regulate inflammation. In terms of introducing what inflammation is, there is always the need of a stimulus, which could be an infection, it could be a trauma. In our case, in this example, it could be a leaky gut. Okay? Now, in terms of having this stimulus, okay, then one would need, it's important to have the inflammatory process in place. That's extremely important. We need inflammation, not something wrong. We need inflammation. But inflammation should be in the context of the gray pathway, so the one on the left, which we call the healthy inflammation. Why? There is a problem, there is inflammation, it's an acute inflammation, there is the tissue immune response, so there's immunity and those who respond by the tissue. And then it goes back to a healthy inflammation, and that inflammation needs to be resolved. That's extremely crucial, okay? Because after the insult is over and the inflammation did its job, inflammation needs to stop, to resolve, so that we could have what we call cellular and tissue homeostasis, going back to home, basically, going back to home in terms of going back to normal. Okay, we cannot have inflammation all the time, although it's extremely important to protect us. Unfortunately, if we don't have the right balance of microbiota and we don't have the right lipid profile balance, which produce also substances that resolve inflammation, then we do fail to resolve it. If we do fail to resolve inflammation, now instead of going back to home, going back to normal situation, we go into chronic inflammatory disease. Okay. So the word resolution here is the most important in controlling the intestinal inflammation and resolving chronic inflammation. Okay. And to do that, we have to measure two things. We have to measure the microbiota balance, and we need to measure the lipid profile balance. When I say lipid profile balance, I'm not talking about LDL, HDL in circulation, but I'm talking about specifically the omega-3, omega-6 ratios that are extremely important in producing anti or pro-inflammatory substances. Both are important because we need inflammation when we need it, but we need to resolve it. Hence the importance of omega-3 in resolution of intestinal inflammation. Yes.
Okay, can I just come in here very briefly, Godfrey?
Yes, please.
This
Yes,
diagram is excellent. The way you have explained the acute and the chronic inflammation is very understandable. The main problem with all the chronic diseases we are having, the baseline is inflammation, is the overreaction of the immune system. And I think what you're stating here is very, very understandable. And I hope people who are listening to this will get a grasp of what is inflammation, because that is the main problem with chronic diseases, even diabetes, cardiovascular, autoimmune, certain cancers,
right.
and mental and emotional problems. They're all related to inflammation. So I think that was a very good diagram to explain very simplistically what is acute inflammation and chronic inflammation. The other thing perhaps is that one can also gauge the amount of inflammation by doing the blood test, the C-reactive protein, which is a good indicator of how the inflammation is in the body, whether there's any improvement besides the omega-3 and the testing of the microbiota of the gut. Thank you.
Absolutely, absolutely. Of course, this does not replace, as you very well said, does not replace the normal blood tests that are required, which would include the C-reactive protein. There, I would like to add something. We did see individuals that have chronic inflammation, but their C-reactive protein is normal. Okay, so therefore, although it's extremely important to look at C-reactive protein, it's also important to look at these disbalances. Another thing, why it's important to look at these particular tests is that sometimes there is a high C-reactive protein. And unfortunately, I understand the clinical scenario. Unfortunately, general practitioners would not have an understanding of why that C-reactive protein is high, and therefore there is no intervention because there is no cause. So it's absolutely, I agree with you. We definitely would need to do also blood tests which are normal in clinic.
Can I ask a question, Gottfried?
Yes.
What about those who undergo a surgery, or they have an organ disability, or maybe even genetic disorders from newborns even? They are maybe into the failure to resolve, and they are like the disorder itself undergoes a chain reaction of going and being always in the inflammatory level. So what about those who literally has a disability? They cannot control what they already have.
Yeah, I mean, it's an excellent question. I mean, that's why we always talk about personalized interventions, because we would need to cater for special needs depending on that particular person. In terms of resolution, I need to really go deeper to answer this question. But in terms of resolution, it is here we're talking about the supplementation of a specific substance like omega-3, which is extremely important to rebalance towards anti-inflammatory responses. In this case, this is also done via specific enzymes. If there is, of course, a genetic defect in these particular enzymes, one would have to look into a specific personalized intervention. Okay, any more questions or interventions?
Can I ask another question, please?
This is a Q&A session, so you
Okay,
can ask as many questions as you want.
What about the famous butyric acid?
Yeah.
There is this trend that if you take this, there is a supplement as well. It's an anti-inflammatory, natural anti-inflammatory, right?
Yeah. Yes.
What do you think about that?
Well, actually, I didn't mention the name, but if I go back, I mentioned these short-chain fatty acids. Okay. No, these are three. There are three types, which are main ones that we produce. One of them is butyrate. So here it is. We have acetate and propionate. Okay. And yes, if somebody has very low butyrate producing bacteria, because it's produced by specific bacteria, and we do provide supplementation of butyrate until we get the balance back to normal. Okay, so yeah, it's extremely important in anti-inflammatory, but not only anti-inflammatory. Butyrate is the actual energy source of colonocytes. These are the actually cells that are in the gut lining, which are extremely tight together. And thank you for asking this, because I forgot to say that the gut lining is a one-cell thick. It's one-cell thick and has to be extremely tight and hold like together, so that it is not leaky. Okay. Now, if there is lack of energy source for these cells, they become with a problem with tight junctions, etc., etc. So this is an important substance which we even look at when we look at the dysbiosis. One of the main things that we actually intervene on in terms of dysbiosis.
And I have another question here and said, is more bacteria more gas? Does it result to more gas bloating, or because there is this?
No, so wait, that's again very I need some time to answer that, because more bacteria doesn't mean that it's more beneficial or more dana. It's important to balance. Now gas production is normal. So I go back again to my nice pie chart here. Okay, that's because of this process, which is called fermentation. Bacteria ferment substances, nutrients, towards other substances. During that fermentation process, which is also used by humans to do alcohol, by the way. So by fermentation, gas is produced. Now, which type of gas is produced and how many, the volume of gas is produced depends on the diversity and the abundance of bacteria doing this particular process. Okay, so that's why rebalancing the bacteria is extremely important, also for reduced bloating, gas production, etc., etc. And then it also depends on the nutrients that you eat. Okay, so I would say that fibers are extremely important, but fibers will produce, it goes via fermentation, it will produce gas. So they are important nutrient, but you have a side effect. Okay, so.
Yeah, there's a point again. I just want to mention very briefly about butyrate. I've noticed recently gastroenterologists prescribing this powder butyrate to patients having gastrointestinal problems. Now that is good, because that's one of the short chain fatty acids, very beneficial to the health of the person through microbiota. But the patient, when you ask them any more detail about any other information that the patient might have had about lifestyle factors, about nutrition, about sleep, about stress, they don't know much about it. So what I'm trying to say here is it's just one little aspect of microbiota which they were given, the butyrate, and that was it really. So what you're doing here exactly is the lifestyle practice and advising people on other factors of lifestyle and improving the microbiota is very beneficial. But this is I just wanted to mention to you that I've come across quite a few patients using butyrate as a powder form in their health management, which is a very tiny aspect, but an important aspect as well.
Absolutely. And in fact, I've spoken to gastroenterologists about this particular issue. And they understand the importance of nutrition and lifestyle changes, and it's important to refer to a lifestyle medicine clinic and these particular individuals, also because it is contraindicated to give butyrate for more than 3 months. It's important to give butyrate in terms of supplementation until the dysbiosis is resolved.
Exactly.
Okay, so that's a very important point.
And the other disappointing thing for me really is people being on PPIs. This is the proton pump inhibitors, the antacids. Some of them have been there on these tablets for about 1 or 2 years, not realizing what other side effects they have. But this is my view anyway. I'm just.
No, it's an important view, because we're talking about substance use here, and I'm not sure if Katarina is with us. I'm not sure, but with something that we will discuss with you as well, Dr. Pandya. Actually, we've put you in a link of WhatsApp actually, because the idea is also to include pharmacologists.
Absolutely, yeah.
To actually take care of these particular interventions. And substance use is one of the main ones, as you say. I mean, one would keep on giving, medicines. We've just had some discussion earlier today, where we're looking at different types of drugs, and there are some drugs that are actually need to be activated by the right bacteria to be as efficient as possible. So we're looking into that detail as well. Thank you for that.
Very briefly, even antibiotics, the local use of antibiotics here, when they're indicated, very, very important antibiotics. But I feel some of the antibiotics used here is not indicated. And one has to know that one course of antibiotics, it will take the microbiome at least 5 to 6 months to recover from one course of 7 days treatment of antibiotics.
Yes.
So there are many really one has to consider.
Yes, that's true. And Dr. Pandya, we also have some individuals that have a problem and do not want to take more antibiotics. Antibiotics are important in some circumstances. And we are also helping them with antimicrobials, which are essential oils in terms of antimicrobials. And we do have very good responses. So, so that's something that I wanted to point out.
Thank you.
So we have a question here in the chat. I'm trying to take care of everything. Let me see. Good. Why is it contraindicated to give butyrate for longer than 3 months? Can it be harmful? Okay, so thanks, Claire. Butyrate is a food supplement. Okay, so in itself, it's not a medicine. The important thing is that if there is dysbiosis, and in general, one would not produce butyrate because there's a dysbiosis. And we don't give butyrate if the dysbiosis is not related to butyrate producing bacteria, okay? Because that's why we look at the cause. But if it is produced by, is given due to lack of butyrate producing bacteria, then we give it for 3 months. In the meantime, we'll be restoring that balance. Okay, it's extremely important to restore the balance of the bacteria because otherwise it will move on to other issues as well. Okay, so restoring the microbiota is an absolute necessity. Giving butyrate is important until you restore that. Okay. Yes, there are people, as we just said. So we just said that it's important that we look at the issue of, the question was that there are people that have been using it for years. That's true. This is why it's important to look at the cause. And if you ask me, is butyrate necessary? I would tell you, I don't know. I really need to know what is the dysbiosis. Okay, so, but it does help. It does help, and important is to restore the dysbiosis so that you can produce your own butyrate rather than taking the supplementation.
Yeah, and Gottfried,
yes,
this is one thing that people try to add something to a lifestyle that is already disabled, that needs change, but instead the people have this idea that you take this pill, you take this powder, and you can continue doing whatever you are doing. And people really have problem with change. And that is something that through lifestyle change and intervention, that is why it's important that we're not considering just one aspect, but several aspects that we need to change, not just taking this, whatever, if it's natural or pharma, whatever. This is something that it's an extra to support you in the change. it's not the solution, it's the support for the solution.
Absolutely, I fully agree with that. I fully agree with that. It's important, as I said, it's important because you need it. But in the meantime, you have to do something. You have the first thing you have to do is to understand the cause. That's the first thing. And if I don't see what the cause is, I even don't give or start someone on butyrate. I have to see it. And then in 3 months, I have to make sure that I change that particular dysbiosis into the right things using the interventions that we mentioned before. Very good. Yes, I agree fully. I repeat myself because I feel very strong about this. Okay, very good. So, yeah, okay. So, of course, we always want to move from left to right. Okay, ideally, we're already on the right side, but if not, we need to move from left to the right side. And therefore, the way to do this is that we measure the microbiota, measure these bacteria. We look at the disbalance, as you can see here in the red part, left part, there is the disbalance. I'll see if I can make it bigger. The slides are too small or because mine is a huge done. Let me try to do something. If something happens, I will restart, okay? Oh, okay, I stopped sharing by mistake. Okay, give me a second. Did I stop sharing?
Yes, Godfrey.
Okay.
We can see you.
Okay, that's good. Finally, you can see me, right? Okay, good. Is that better?
It's better, yeah, much better, yeah.
Yes, thank you.
Okay, good. At least I know what to do with the IT systems. But I have some issues to look at the chats now. Much better. Okay, good. Okay. All right, so we always want to move from left to right because the left is a dysbiotic situation. This is what we read. And dysbiosis would result, as we said, in inflammation. Then inflammation would result into various metabolic diseases. Okay, so this chronic inflammation. It can result in weight gain. It results in, so sometimes you do diets, and you say, I should be getting thinner or better. I should not gain weight, but instead you're gaining weight. Well, the underlying answer is that you most probably have a chronic inflammation of the intestines. There is also issues with insulin resistance. There is issues with leaky gut. Therefore, one would have a lot of immune responses, inflammatory bowel diseases, and of course, always very important, depression as well, which becomes a vicious circle against the gut health. Okay, so what we do is we try to push this to the right, whereas there is enough butyrate, there is enough anti-inflammatory reaction, the balance of the bacteria are correct. And one extremely important aspect of trying to move this towards an anti-inflammatory action is the use of omega-3 supplementation. Okay, that's why it's extremely important. Now, it's important not only to move this into, because it's like a substance which helps in even the beneficial bacteria to cultivate more, also because there are polyphenols and such oils. But also, as we said before, they also produce substances that are anti-inflammatory, which are not shown here. So it increases butyrate through the microbiota, but also produces resolvents and protectants for the anti-inflammatory action. It is shown here. Okay, so like to resolve inflammatory responses, we need to reduce this. What we do is we provide better sources for the gut lining to be stronger and very tight. This is where butyrate comes in. We need to introduce more and cultivate and stop the opportunistic bacteria to grow, to increase the butyrate producing bacteria so that we produce more butyrate again, which is natural in that case. We provide omega-3 to reduce and produce specific anti-inflammatory substances such as resolvents and protectants. And something that I didn't mention before, there's also a very direct link between the microbiota and actually in the increased immune response, or actually chronic immune response, let's say that. Which is, immunity is different than inflammation, okay? So inflammatory responses is one thing. Immunity is you have immune cells that become activated to produce other cells, immune cells, to combat an insult, okay? Now, having the right microbiota, they produce specific substances that increase and expand specific type of immune cells to regulate this huge immune response. Okay, so there are, you actually call them Tregs, regulatory T cells. So they regulate the huge immune response. Immune response is extremely important, but needs to be attenuated, needs to be, I can't say stopped. The word is attenuated, so moderated. Moderated is a better word, I think. Now, if these microbiota are not available, and therefore these specific special cells that moderate the immune response, okay, then the immune responses, because insults are always there, okay, so the immune responses will be continuous and at a high level. And that's what we call allergy. Okay, so allergy is can be controlled by the right microbiota levels and by regulating the immune responses. Good. So now it's time again for Q&A. Please, although we did have some done, but this is a Q&A session. Absolutely. Yes, Dr. Pandya. So another additional information that I did not provide is that 80% of our immune system is actually within the gut. Okay, so and the reason being is because the immune cells learn. Think about the gut as the learning hub of immune cells. Why? Because, as I said before, this tube is an external tube inside us. And therefore, the direct interaction of these cells with the environment is actually within the gut. They feel what's in the gut, in the lumen, in the hollow tube, and they learn for eventual, okay, so they learn for eventual threats. Now, because they are always learning, there's a learning hub in the gut. It's also very important to tolerate this immune response. If we don't moderate it, we cannot tolerate it. Okay, so moderation is extremely important to tolerate the immune response in the learning hub, in the school of the immune cells. Okay.
So, Godfrey, I
Yes.
believe when you are saying this, I think about epigenetics.
Yeah.
Is microbiota related directly to epigenetics?
I mean, let's give you this. I'll try to answer this in one sentence because it's a very complex question. Butyrate itself is a histone deacetylase. It's a type of molecule that results in an epigenetic modification. Okay, so I try to answer this. So the answer is again, yes.
Can I just come in here very briefly? There's
yes, please.
New science about epigenetics and genetics. Now, people say the disease is genetic. Only about 15% of our diseases are genetics. All the others are controlled by epigenome. Epigenome is the part of your chromosome which is at the end of chromosomes. And this epigenomes, the part on the ends of the chromosome, are all under the influence of lifestyle factors. So what I'm trying to say is that any improvement in lifestyle factors is going to affect the ends of the chromosome, which in turn will control the expression of the genes of your chromosomes. Very briefly, this is very briefly and very simplistically I'm trying to explain. So what Gottfried said, yes, epigenome is controlled by lifestyle factors and eventually the expressions of genes in our chromosomes as well. So yes, I agree. There is a genetic component in some of the diseases, but it's only 10 to 15% of the diseases which are actually due to genetic problems. Otherwise, we can all control through epigenome. There's a new science at this moment.
Absolutely. Absolutely. Okay, so we have some additional questions. Well, let's say this, I'm really enjoying this session. Please continue with these questions. It's really good. So I have this. Thank you for your, okay. Could you kindly say a little bit more about moderation of the immune system? Okay, let me try and hope I can, yeah. Okay, let me go. I know that there are the questions. I'll come to that. Okay, so we'll come to that. Okay. So the immune cells, there are two types of immune cells. We call them T cells and B cells. Now, here I'm going to talk about T cells only. The B cells, think about them as they produce the antibodies, okay, and they remember the threats. Okay, so the T cells, when there is a threat, whatever the threat is, okay, I call it an insult. Let's say there's an insult. Okay, something shouldn't be there. There's an insult. And when there's an insult, of course, our immune system needs to attack it. Okay, so that's how it's. Now, to learn, there's importance to have a learning experience of these T cells because so that they recognize the different insults that can come into our body, they need to learn a lot of different potential insults. Okay, so it's not happening, but it's learning, like vaccination. We vaccinate against specific viruses. I don't need to explain that any further because we've been through it for a number of years. So you vaccinate against the virus. We don't give the virus, but we need to give something which mimics the virus. And therefore, these cells will learn for a potential threat. Okay, so that when we have the virus, they already know about it, they can recognize it, and they can attack it immediately. Okay? So that is a little bit about immunity. Now, since there is a whole school, okay, in the gut of these immune cells that are always learning about potential threats, okay, not threats, but potential threats, because they are still in the lumen anyway, and they are in the environment, they are outside, okay, in the tube, which is in our body. Okay? So they're learning all the time. Now it's very important that you have something that moderates them, okay? Because they go into a response. You have to moderate them. Otherwise, it will be a full-blown response, and you don't want to do that. They are learning, okay? To do that, you need a specific set of special cells, which are regulatory cells. They regulate the immune response. To have those cells, you need to you need specific signals, and one of the signals comes from specific microbiota in the gut to regulate and expand these regulators to modulate the immune cells so that you can tolerate the school and minimize on actual a full response. If you lose these moderators, due to the environment is still there, they still are learning, they still go for a response, and you cannot stop them because you cannot moderate them. That is equal to a food allergy, an allergic reaction. I hope that helps. Okay, so we have more questions here. Also, the environment. Maybe I need to understand the context of this question. You can also unmute and ask, okay? I mean, it's not a problem. Maybe it's better because I didn't understand the context of the question, of the statement. And then we have other questions. Let's see. When is somebody, okay, dairy intolerant? We're talking about dairy intolerant. Yeah, the immune response to these particular antigens, to the components, is definitely abnormal. Yes, of course. Well, I was reading recently. If you unmute and talk, I mean, you give me a little bit of time as well. But okay, I was reading recently that human beings were not meant to drink the milk of other species, and hence many people are allergic and intolerant to dairy. Is the intolerance abnormal, or is it simply a reaction to a product which was not intended for us? Okay. Oh, thank you very much, Claire. It's a very fascinating question. So let me try and answer it in a simple way. Okay. Dairy products, you need a specific enzyme to digest the sugar that's in the milk. Okay. And that's called lactase. Okay. Now, if you look at, I know it's going to be a bit difficult, but I'm trying my best. So if you look at the means of controlling the production of lactase in human beings, we know that the lactase enzyme in the normal development phase of a human being from childhood to adulthood, that lactase gene should be switched off. Okay? That's normal. The normality is that the lactase gene should be switched off, and that's done via an epigenetic modification. Now, if during the time of evolution, when human beings started utilizing cattle to drink milk, okay, they've put a pressure on evolution to actually we also have mutations all the time, okay? In our genes, we always take mutations. We of course tolerate them, etc., etc. But if there is a specific pressure by drinking milk, which we should not drink milk in adulthood anyway. But if there is a pressure to do that, if there's a mutation in a specific site of this gene that helps the lactase protein to be produced in adulthood, then it is going to be selected for because we're drinking milk. Okay? And this is what happened. It's just by evolution that we put pressure on the evolutionary process by drinking milk in adulthood. And nowadays, 60% of the global population is tolerant to milk and 40% are still intolerant. So basically, I can say those that are intolerant are normal, and those that are tolerant of milk are abnormal because they have a mutation which keeps the lactase enzyme the production of lactate enzyme in adulthood. I tried to explain this as simply as possible. Sorry if it was difficult. I hope I did a good job. Okay, another question. Okay, okay, so it's the same one. Okay, good. Oops, that one. Okay, okay. I'm trying to do a check. Oh, there's more questions here. Good.
Hi.
Yes.
I was just trying to explain a little bit about the immune system, you know.
Yes, please. Yes, please. Go ahead.
A huge topic, really.
Yes.
You know, as you mentioned about the various T cells and B cells involved in the immune system. But basically what I was trying to explain here is that it is used for two aspects, for defense and tolerance. Defense, it defends us from the outside infections, and from the inside, it's mainly cancers. Many cancers, I mean, we are mutating all the time. There are about 5,000 mutations in our body every day, and this is being dealt with by the immune system. So we do not have cancer. So immunity defense-wise, we have protection from outside infection, inside is cancer. And the other aspect is the tolerance aspect of the immunity. From outside, we have the allergens. You know, we are protecting ourselves against allergies, rhinitis and seasonal rhinitis and asthma and all that sort of thing. And from inside, of course, if it is overstimulated, we start getting the autoimmune diseases. Again, I'm trying to be as simple as possible, but this is the brief explanation of immunity in our body, basically. Thank you.
Okay, thank you very much for your intervention. Thanks. Yes, good. Let's move on. You know, it's really great time together, but we need to move on. Okay. I'm going to go through this quite in a fast mode, so that I give you more time for questions as well. Okay. So now, in addition to immunity, there is also neurotransmitters. Okay. We know that 95% of serotonin, which is so known as 5-HT in the scientific world, is produced by the gut. And serotonin is extremely important for the motility of the food, digested food in the gut, because keep in mind that the gut has its own autonomous nervous system. And it's also important in terms of utilizing it in the central nervous system. Okay, so it communicates the gut. So gut-brain axis. Okay. Then there is dopamine, also linked with depression and anxiety. It's also linked with IBS. And GABA, which these are all neurotransmitters that are produced in the gut. Okay. There's also the issue of hormones. And as I said before, some hormones need to be excreted or recirculated. That is actually microbiota, and some bacteria in the gut are capable of doing that conversion. And actually, we started talking about what is called the estrobolons, which are actually bacteria that decide for us if the estrogen should be excreted or recirculated into the bloodstream. And that depends on specific modifications on the protein, which can be removed by specific bacteria because they do have the enzyme and we don't. Okay, so the presence of this bacteria is important for excretion or recirculation of estrogens into the bloodstream, which is important because you would have accumulation of estrogens in the bloodstream if you don't have these bacteria. And there are others. Okay, we mentioned short chain fatty acids, but there's also the branch chain amino acids and also specific chemicals like TMAO, trimethylamine N oxide. That's important in terms of the name. But just think about this. So whilst short chain fatty acids are all having a positive impact on the physiology of the body. The brain chain amino acids do have positive, but also do have negative, and that also depends on why physical activity is extremely important, because in the context of physical activity, they become useful, beneficial. If somebody is totally sedentary, you have both aspects of promoting health and having a negative impact on that. So it's important. That's why the 7 pillars, physical activity, should be there, okay? Because these have two things that go against each other, basically. Okay, there are various issues, but putting in physical activity and it will promote this as being a beneficial metabolite. Whilst TMAO is definitely a negative impact, and that also depends on the dietary interventions that we do.
Godfrey, can I ask a question?
It's Q&A.
Yes, yes,
Right.
but I always ask first, right?
Okay.
Something came to my mind, and I remember my mother telling me that everybody has a condition, right? Maybe it's different, but everybody has something, so you should be okay with it. And what I think is that everybody has a kind of imbalance. And when we go also to people who are healthy, I think they should test also to prevent from being unhealthy. So if they are in a level of tolerance that if they pass it, they become unbalanced, why you should wait of being unhealthy to eventually change your lifestyle before it's too late. It's like getting cancer first and then try to be super healthy now. I think we need to work in preventive care. And what you are providing as a program, I believe this is not just about people who are unhealthy, but people who really want to know how to remain healthy as well. I think that is a very important question.
Yes, absolutely. And in fact, when I started putting all together the information, knowledge, and the aspect of such programs, my intention was to prevent disease. So that was my focus, to prevent disease. But thankfully, such programs can also be used to restore conditions, not disease, conditions, to restore conditions that are leading to a disease, but really to restore them back to home, let's say home again, okay? So back to normality, okay? So, and it's important because here we can actually indicate those individuals that are in the bridge between normality and the disease. And therefore, in that particular case, in this particular case, we call it a syndrome, okay, not a disease. But yes, prevention is also, that's why we actually set this first to prevent disease, but of course we have those that are in the bridge in between prevention and the disease on the other side. Okay?
Do you believe that if there is a kind of preventive care from the medical system, let's say this program is implemented, that, let's say, I'm giving an example, a child that is in puberty, especially in puberty when there is this hormone change, maybe it's an option for people to test themselves, so to know that which level they are in this boundary. So
Yeah.
so they don't eventually get the problem, they prevent it, right? At least they try.
Yes, this is one of the most difficult arguments that I can discuss, because whilst the healthcare system is there to treat disease, because that's something that you can diagnose, okay, and this is a good thing. I mean, what we try to do mainly is to provide the knowledge to understand this. And then with that knowledge, one would intervene. But the health system, keep always that in mind, that the health system works on treatment protocols. It works on diagnosing a disease and treating. Okay, so prevention is important, and I agree with you fully. Okay, so knowledge is the strength in prevention. Okay. So,
Can I just say a couple of words here? What you mentioned, Alex and John, Godfrey, very, very relevant. What's happening in medicine at this moment is, as you said, Godfrey, we need to diagnose, investigate, and treat the condition. Now, the condition is symptoms, really. So we are trying to treat the symptoms and keeping the condition under control. What we are failing, really, this is acute medicine. I mean, what we're failing basically is to go upstream to find out why, not what. We have to address the why. Why is it happening? You know, in the causation of each disease, and try to get to that matter by lifestyle factors and in the prevention aspect of the diseases. So yes, it is important to keep what the condition is under control, but I think one has to even address the issues as to why it happened, and perhaps try to address those issues, the causes of the diseases, and see if that can be managed and made the condition less troublesome or even reversed in certain cases. That's prevention.
Absolutely.
So it's prevention, management, and even reversal in some cases. Even diabetes is being reversed, type 2 diabetes, with proper nutrition and the microbiome health and all that sort of thing. So it is possible. So what you mentioned, Alex, about prevention is very, very important among the young people and the rest of the population anyway.
Yeah, yeah. Well, you know, knowledge is very important. I know, and people all know that. Example, fast food is not good, right? Especially for the microbiota. But still, there is this massive amount of people who have issues with time management, and they are full of other things and disregarding their health, you know, and they focus more on the money, right? They know, but they don't act. So I think the system needs to provide something that is more healthy, even though it's fast, but that its knowledge is not enough. People, they disregard the knowledge, like the people who smoke and see that label that cigarettes actually kill you, and they still smoke them.
Yeah, education is the most important, really, to the public. Educating people about what we are discussing at this moment. But at the end of the day, it's upon the individual what the individual really wants. Was it health, or, you know, we are all stressed. We all have lots of things to do in our lives, in our days. But we have to prioritize sometimes what is really important to us. Is it health or any other thing? People wait too late sometimes. You know, we get the disease and then they start thinking about how to manage it instead of just thinking about what can be done in order to prevent. You know, we have a very high incidence of obesity in Malta, diabetes, cardiovascular. So I think educating people on this sort of aspect will be very, very useful, I think, personally.
Yeah, I think it's good, yes, and that is very important thing. But I am also putting my interest in helping institutions. That why should we have an option of you know, choosing something that is good or bad? Why choosing something that is good or good? It's just maybe the taste is different. So why should I choose between a salad and pastizzi, you know, or something? If that is not healthy, I think from my personal experience and all the diseases I saw in my life, I think if that is not good, that should be removed from the system. So that is what I believe should be.
Yeah, I mean, I think everybody is in agreement with this.
Yeah.
But we live in a real world, which is made up of different pressures and different mentalities. So, yeah, one of the biggest issue, I mean, one of the biggest sort of impact is, of course, we have all these already in society. So we cannot change that as such. I mean, what we can do is we try our best to that's why I say that education is the pillar on this, because we cannot change what's available. What can we do? I mean, as you said, I mean, on a packet of cigarettes, it's telling you it's killing you. You still take it, So yeah, this is the ultimate of somebody who is not health conscious, right? I mean, so we need to drive evolution toward health conscious people.
Usually people get conscious through diagnosis. Until they get diagnosed, then okay, yeah, I'm conscious.
But I cannot diagnose anyone who hasn't any. But I mean, we can do a gut bacteria test to everyone, and we start diagnosing. So you know what I mean. It's yeah. I agree with you. We'll do our best. We use our tools to try and convince people about that we are right. So, yeah. Yes, I know. I have a number of comments here, which I also agree with. But we cannot do much about stopping fast food.
No, we can't actually, because if you think the American guidelines for nutrition, it is made up. It is recommended by medical doctors, but before it becomes a guideline, it has to go through the government and the pharmaceutical and the industries for their interest before it is made concrete. So you can see the influence of other pharmaceuticals and industries in promoting the guidelines for nutrition, for example. So a lot of influence. At the end of the day, it depends on the individual.
Let's think about very positive about this. I've been giving information out for 2 years. To be honest, this is the first event I am enjoying, because there's a lot of people talking to me, and a lot of people really believing in what we do. So that's what I see in terms of positive. We need to educate people, of course. Okay, but we cannot change the world. I mean, that's something we can actually do. Okay, let's continue. I have a lot of chats. Please do intervene, because it's very difficult for me to follow every chat item that there is. Okay. So yeah. Okay. Yeah. So what you're saying? So everybody is writing. You can read the chats, and yes, tell me.
Pizza.
Wait a minute. Please try to mute.
Għamilt il-pizza jina.
Sorry, try to mute, please. I cannot now, because I changed my options to keep on mute.
They can't.
Okay, good. All right, so the last part, because I'm going to stop soon. Okay, so it's already 1.5 hours. Thank you for being with me for so long. It was really a nice event. So the last part is about the gut-brain axis, and we know of specific mechanisms and also triggers in between the gut-brain axis, the importance of serotonin, which is produced by the gut, the importance of immune system. We discussed that a bit today as well. There's also a direct connection between the brain and the gut, which is the vagus nerve. Okay. We discussed all the metabolites, I would say, in general, the bacterial molecules. And the triggers are the right microbiome. There are food particles, which are triggers, the issue of leaky gut, and also acidity in the stomach. So I can go through this very quickly because we mentioned this, the importance of chronic inflammation, and that it's also related to depression and anxiety. There are specific bacteria that are important to reduce the anxiety behavior and anxiety-like behaviors. Okay, we mentioned GABA. Okay, and we know also which bacteria are important in having these kind of effect. The microbiota, we mentioned these, that there should be the right ones, the right abundance and diversity. I always like to put this in because you remember it most probably. The tryptophan shot, okay, which is definitely one of the triggers of food parties for good mood. Hot almond milk with dark chocolate, okay, that is actually a tryptophan shot, and tryptophan is converted to serotonin. The problem of leaky gut, we mentioned this in the inflammatory slides. The relation between microbiota, diet, and cholesterol is also very important. And here I mainly focus on the lipid testing, looking at saturated and the various mono and polyunsaturated, in this case, like omega-3s, omega-6, and omega-9s, and trying to balance this into the right composition, which is a 3:1 between omega-6 and omega-3. Unfortunately, we've done multiple tests here in Malta, and from all these tests, I only found 3 individuals that have something less than 5:1, okay? The others are in the region of 10:1, we found 30:1, and last week we've hit the target of 90:1. So it's very important to look at this ratio, and we start rebalancing it towards at least a 5:1, ideally to a 3:1 ratio when we talk about omega-6 to omega-3. Can be done via diet. Of course, diet interventions needs to happen, but it depends on the levels. The first change should be a supplementation-based intervention. But of course, introducing the right diet is also extremely important. There's a various individuals which have very low specific omega-3s like ALA, okay? And these, it's important, we know which diet ingredients are important to introduce or increase in the dietary interventions. And some of them are quite nice and tasty.
Just a quick question, Godfrey, for you, perhaps. Familial hypercholesterolemia.
Yeah.
Respond to changes in the
Okay.
Familial, right? It's familial.
Yes. Okay. So I have 2 individuals currently on the programs. We are testing it. We are looking at LDL, HDL levels.
Yeah.
One of them told me that he has a nice surprise for me, but I don't have it yet. But because he's a scientist as well, so he's doing all the tests and a number of, more frequently to see what's happening.
Yeah.
I will answer that question hopefully in the next few months.
It's very interesting. Very interesting.
It's very interesting. Yes,
yeah,
it's very interesting.
We have people who have high lipids, and the only advice they get from the medical practitioners is, be on a diet for 3 months, do some exercise, try to lose some weight, which is all very well said and done. It's not easy. And then we'll check after 3 months and see how your cholesterol is. But I think this sort of choice, alternative choices, what they can do with regards to their cholesterol is very, very interesting. And I think this should be taken seriously, really.
With regards to cholesterol itself, okay, we are now introducing a new program specifically on cholesterol. And there we are looking at even specific bacteria to introduce, like Lactobacillus plantarum, which is extremely important to excrete the bile rather than recirculating the bile. And that's one way how to reduce LDL, which eventually is important because most of the atherosclerosis done is LDL.
Yeah, we're talking about LDL here, aren't we? Not the cholesterol. LDL more than cholesterol, really.
Yes. Yeah.
Very, very important, the gut-brain axis, the connection as well. Since you mentioned that, the connection between the vagus, how the vagus nerve connects the brain, the heart, the lungs, and the gut. This can be used in de-stressing mechanisms as well. There's so many things one can do with this microbiome and all the connection it has with the various organs of the bodies and diseases. It was a lovely afternoon today. I really enjoyed this. Thank you.
You're welcome. I think, yes.
About the famous low FODMAP diet,
Yeah.
And the relationship with the microbiota. Many people that I know who have IBS, they stick to this diet that the professionals said that eventually this should be a temporary, not a permanent diet. And people are sticking to this diet and they're missing fiber, example, and the immunity is going down as well. So they solve temporarily the symptoms, but then they create other issues, which eventually could be more than the actual symptom as well.
Yeah. Okay. Yes, I totally agree with that. Low FODMAP diet is important, as we said as well with the butyrate supplementation, for a specific term. But then reintroducing specific fibers is extremely important for rebalancing the bacteria. And we do have a lot of experience with that. But it has to be driven through a nutritionist. Okay, so it's definitely something that we're looking into and providing help in reintroducing, using challenges. So it's just not easy to introduce fibers as we wish. What we do is we introduce a challenge. Well, I am driven by tests. Okay, so this is me. Okay, so I do a challenge test, and I check if somebody would have a specific sort of issue with specific fibers, and then we start introducing them. Okay, so it's important not to keep low FODMAP for a long time because there's a lot of deficiencies related to that.
Hello?
Yes.
May I ask a question, please?
Yes, of course.
So today we know that one of the management tools for IBS is SSRIs, which is selective serotonin reuptake inhibitors. I was wondering whether their action is aimed at the gut epithelium because IBS sufferers might not be able to produce enough serotonin from that location, or is it more aimed at controlling anxiety, which might be the underlying cause of IBS in the first place, or maybe both?
Yeah, well, in this case, I would say it's sort of both, but Dr. Pandya, maybe you would like to intervene here.
I agree with you, Godfrey, here. It could be both, really. I mean, we all know IBS if the diagnosis made after all the other pathologies are excluded. So they don't know what the cause is. But I think there's a strong connection between the gut and the brain, and hence IBS as well. So it's triggered by even emotional and mental issues as well. So what you said, Claire, is it Claire? Your name is
Yes,
Claire?
yes, it's clear, yes.
It could be a combination of both the factors you mentioned, really, to dampen the anxiety, which might help the microbiome, and even to increase the production of the happy hormones as well. So I think you're right in there. It's a combination of both the factors, really.
That's good to know. Actually, my 17-year-old daughter suffers from IBS, and she did very well on. When I say very well, I mean that it was the first line of treatment prescribed to her after 2 months of intense pain and anxiety. And after 3 days, all her symptoms disappeared for a whole month, which was impressive. After that, one bout of diarrhea returned per week, but remained stable thereafter for a further 9 months. She's generally a happy child, doing well at school. What I'm wondering about now is whether she will need to stay on the SSRIs indefinitely, or maybe.
Yeah.
So that's exactly what we're saying here, right? So it's important to see the cause, because understanding the cause, it is a temporary. It's a great solution, yeah. Like we said with butyrate, we do the solution. We have to give butyrate, but in the meantime, we see the cause, try and rebalance any dysbiosis which is there, so that serotonin will keep on being produced in a normal homeostatic way. Okay, so that's very important.
There's another example of strong connection between the brain and the gut. So I think about the SSRI, I think it has to be decided by the doctor who put your daughter on it. We don't.
Yes.
That's one thing, but I don't think she should carry on for too long. Really depends on how the symptoms are. And get her microbiome checked as well. That would be an interesting thing to do as well, I think, personally.
I'm just checking about SSRIs. If you check about the leaflet, what say that the common side effect is anxiety, indigestion, diarrhea, constipation, loss of appetite. Those are all issues related to the same symptom, right?
All medications have side effects, right?
I've put medication as one of the pillars. Substance use, okay? Substance use is medication, so that is one of the pillars.
We're talking about statins, we're talking about omeprazole PPIs, and we're talking about treating Helicobacter. There's a lot of things here which needs to be addressed, but we're just looking at the whole picture at the moment. If you go into details, there's a lot to discuss anyway. So all medications have side effects, basically.
The issue with IBS is that the cause is so complex and multifactorial that it takes a lot of time, months, maybe years, to narrow down what the causative factor is, and maybe it's even more than one. In her case, after almost a year, I can say that anxiety related to puberty, social pressures, and whatnot, teenage years, teenagers face a lot of stresses that we are unaware of. I think they were 90% of the triggers affecting her. And now that she's growing up and finding her feet and becoming more reassured of herself, I think that, slowly, I have a hope that in the future she could be weaned off the SSRIs, and we'll see how that goes. In the meantime, I intend to do a microbiome test as well, of course. But initially, it was all pinned down to food, and we went on a low FODMAP diet for nothing. It was me who eventually realized by testing her every day on something different, but it was
just
a very laborious task.
Absolutely.
And it nearly cracked me up. It was me who realized that it was not food related at all. So these things are very complex, and they are physical factors, there are emotional factors, psychological factors, and it's really amazed
Yeah.
to go through a labyrinth.
It is difficult. It is difficult, and there are various tools to look into it, but not only tools in terms of testing, but also discussing with the individual what is main issues related to, as you very well said, social connection problems, anxiety, sleep issues. You know, all this has an impact on the inflammatory status of the intestines,
Absolutely.
which is the cause of IBS. Okay, so
Yeah, you
so
said it very
definitely,
well. You said it very well, Godfrey. I think the most important is to have your microbiome checked and then pick it up from there, and then use all the lifestyle factors which are involved in the health of the microbiome to treat the condition the patient might be going through. So I think you summarized well there, Godfrey.
Thank you, Dr. Pandya and
Good.
Dr. Godfrey. Thank you.
Talking to you.
you're welcome. You're welcome.
And I must say that this is the first forum I'm attending, and that has so many health professionals joining forces together, as well with members of the public and families of the sufferers. It's I'm really overjoyed to see this collaboration, and may it take us further forward for the benefit of everybody. So I thank you very much.
Thank you.
We'll do our best.
Thank you.
So, yeah, of course, I will end this by saying you can follow us, okay, via various also social media. And one of the things is that we have also a series of talks that we do. That today they are on YouTube, so you can always send us a message saying like, I would like to follow or actually see the previous one. They are all on YouTube. And we also have Facebook, Instagram with all the information. So please do follow us and reach out. Okay. Good. Okay, so we also have interventions here stating that putting links into the chat. Very good. So that's it. Thank you. Yeah.
Can I say something before we end?
Yes.
This,
yes, of course.
There is a stigma that we have a problem of asking for support. Please, the people need support. We cannot do this alone. Even specialists are asking for support. And that's why I, together with Godfrey, we are a team, and we are sharing knowledge and supporting each other. So this is not just about being someone. Everybody needs support, and that's why everybody should ask for it, please. Thank you, Godfrey.
Good. Thank you very much. So we end with the first video that we started, and I hope that we have more events in the near future.
Thank you.